Are you considering having rotator cuff surgery for the second time, also known as a revision? Have you re-torn your rotator cuff? That is something that you really should consider a bunch of facts before you jump into this major surgery. Listen, you've had this surgery once already. You know the process. A period of immobilization, stretching, and gradually return to health. And it takes a while to get back to the activities you want. Some people, it's worth it. Some people, you should really kind of pause, give a little time, and conservative care sometimes is really the solution to you. You can really not have to do that second surgery all the time. But you should understand a few facts first. So also consider how prevalent are rotator cuff tears. You have close to 20% of the people in their 60s have tears. They could be functioning, a lot of them don't even have symptoms. They're fully functional, okay? And once you get around that 80 years of age, you're looking at close to 50%, so half the population have these tears. So you get an MRI, the question is always, well, maybe was this tear here before we even had trouble, and is this something worth repairing? So there are a portion of these people that don't even know they have tears progress, and they actually get to the point where they have a tear, it progresses a little bit more, then they start having pain, they have a loss of function, they have weakness. The question is that, which ones do you do surgery on, which ones are really appropriate? If it's a partial tear, there's some people, therapists and I have talked about, I was like, if we have that partial tear, do we get in there early before it progresses? Or, to maybe a full tear, which is typically a harder surgery and more complicated. So it's kind of that debate, but realizing that those tears a lot of times are existing in people that don't have any symptoms. Good news is people that had some full thickness tears, 75% reported significant improvements in pain and function, what they're able to do, what they're able to get back to. Another study showed that the outcome for surgery and or conservative treatment, physical therapy, were the same or relatively close to after a year. So you really have to wonder, what case am I in? And you really have to have a good, honest conversation with your surgeon about the probability of you getting better. Also, sometimes it depends on what you want to go back to. If we have someone that's highly active and they're really pushing that shoulder, or you've got guys that have been mountain climbers, or people that are doing very physical work, even if they're older, their outcomes typically aren't as good. But we'll talk a little bit more of that in detail. So what are the risk factors? One of the things is age. If you're over 65, your chances of a full recovery are around 43%. So just being in that age category. Younger than that, younger than 65, close to 90 to 95% success rate with a revision. So that age is a big factor that we just can't get around. So size matters. It matters how large the tear is. For every centimeter, and you'll see this in MRI, let's say 1 centimeter tear, 2 centimeter tear. For every centimeter, it doubles the risk of actually having a re-tear, okay? And also, depending on how large the tear is, sometimes if it's been there for a while and it's retracted, they call this term retracted, you'll see that the muscle bellies and all that, since they haven't been attached for a while, they get this fatty infiltrate. It actually changes the nature of the muscle. So even when you attach it, it's not that strong. The strength of it is really not that high. So just think of every centimeter as you go up, it doubles. So that's a big risk factor as far as size of tear. Part of the issue is tissue quality. That's another risk factor, depending on the quality of the tissue of the tendon. So if you have a tendon that's very young, let's say a young pitcher that's got a very great blood supply to the tendon, really doesn't have a lot of what they call degeneration or lack of blood flow to the tendon, and they have a tear, those are much more successful. As we get older, oftentimes in the tendon, the one tendon that you'll see the most in the muscle is this supraspinatus. It kind of rests, it goes just underneath the trap here, it goes to the tip of the shoulder and attaches here. As we get older, I'm over 50, you'll see some degeneration and loss of blood flow. So for someone like me, my chance, as I'm in an older population, my tissue quality may not be the same. So since it doesn't have as much blood supply, once it's tied together, it doesn't do as well. It doesn't matter. It's more apt to kind of tear again. So you got to consider that, and that'll be something that'll come off in the MRIs, and they'll talk about certain degeneration, and you'll be able to make some decisions based upon that. Okay, tissue quality, big issue. Now you'll see this in everything, but another big risk factor is really lifestyle factors. If you have someone that's overweight, there's a lot of different things that affect tissue quality and tissue healing. Okay, if you are a smoker, that can affect the healing of that repair, either make it take longer or not as successful. okay? People that have diabetes. Anyone that has diabetes in the clinic, we always add additional time to the rehab time because we know that they are more, we have to be more careful with them because they're more susceptible to tears or injuries or any kind of, even in non-surgical cases, we typically have to be more careful with their progressing them. So this can be an opportunity to kind of make some lifestyle changes too, but consider that that's a risk factor, and you have to judge that if you're going to go ahead and take that second jump. This is the second time you've had the surgery, and you sure know how much you've gone through if you've done the first time. It's a lot of commitment to this process. Rehab compliance. Compliance sounds so kind of rigid, but do they do rehab? Do they commit to the plan? There's a very structured protocol that we use, especially with the revision surgery. We typically take a little longer. So if you've had the rehab before, we typically stretch out the time frames a little bit more. And also we can have more issues as far as getting the strength back, since it is, we're doing the operation again. There's a greater period of stretching and trying to get the range of motion. Sometimes it's harder to get the range of motion in those revision surgeries as well. So if you have someone that really isn't committed to really, listen, I'm going to commit to this plan, I'm going to work on the rehab component, I'm going to do my stretching at the right time, I'm going to strengthen, and I'm also not going to overdo it. I'm not going to get too anxious and start doing things I shouldn't do. I've had people in the clinic that have jumped in and done the latest workout they saw online because they wanted to get stronger, so they try to push it. So it's important to have that education with your therapist, especially since it's the second time around, and your surgeon, on what I can do at the right time. Some of it, and most of it, should be what they call criteria based, and what that means is when you are ready. Okay, and it's not a time frame. We always talk about, well, at 6 weeks we're going to do this, at 12 weeks we're going to do this. You have to be ready in that time frame for that next step, and that's why guided rehab is really pretty essential, so we don't overdo it and we cause some effect on that second repair. So how common are re-tears after a rotator cuff repair surgery? How common is? They can go from 20% on the low end upwards of 70% depending on the study you see. It is incredibly common. So we have to really realize that we could do this whole surgery, and depending on our risk factors, we can have 20% shot, which is still, I don't know, not great, but 70, like over 50%, you're kind of flipping a coin. Did all this time commitment, and you're possibly going to end up in the same position as you were before. And in larger tears, greater than 5 centimeters, there's a 90% tear. I don't know, 90% chance of it re-tearing. I don't know. 90% is not a good statistic in my mind. That's basically saying, let's do a surgery, and 10% of the time it's successful, if you put it that way. I don't know. That's actually lower than placebo effects. So we really got to consider those larger tears. And revision surgeries have twice the rate of failure as primary. So you're really exponentially increasing your risk just for the fact that it's the second time you're doing it, regardless of size. So is revision surgery, is it worth it? I think the statistic in one group is 90 to 93% of patients actually are happy with the outcome. But the question is, we don't always do an MRI at the very end of the second surgery. We're really kind of looking at, are they happy with their outcome? Are they doing well? If they're doing well, they're functioning, their pain is great, we may have a tear, we could have re-torn it, gone through the whole surgery, we don't even know it. And we're walking around happy as a clam, and we actually still have had a re-tear. We just don't know it. We haven't, and what you'll see is when you have a rotator cuff surgery, unless you're having trouble, no one's going to go ahead and authorize, especially in the insurance environment, another MRI to say, oh, you are right, I'm glad you feel great, and now we're going to look at the MRI and go, oh yeah, we have an intact rotator cuff, or we don't. The fact is you're functioning well. That's really the key. So the question begs to it is, first of all, yes, you may feel really good about it, but is that really the only solution? The question is if we took everyone through intensive rehab, maybe we would have the same outcome. So there is that question, if we're going to come to the same end and still have surgery. But after a year, most people, regardless of the size of it, the conservative PT and surgery are both kind of arriving at the same place. They're both feeling pretty good and not having the same amount of pain. Anecdotally, for myself, I've had a tear in my rotator cuff since 2004. I've had it for a long time. Periodically, it gives me trouble, and then I kind of manage it, and I have longer periods of time where it gives me trouble and shorter periods, and I kind of modify what I'm doing, pull back, and luckily I kind of know some of the tools, and I feel better. It's been there for a long, long time. I'm very active, so in theory, I might be progressing a smaller tear to make it larger, but do I do surgery? I've elected not to, and so far, 20 years later, I'm doing all right. So listen, I'm only one case, but consider that a lot of the studies will show, taking a conservative approach, it might be better off. We also don't have the risks of, as we're getting older, anesthesia, infection. There's all these other problems that occur. Plus, the risk of re-tearing is twice as great the second time around. So, got to consider some of those facts. So, when we're looking at revision surgery, from a therapist standpoint, I tend to be much more conservative. We typically really want the patient to, the range of motion period where we're just stretching you and you're not moving your shoulder, where you're basically immobilized, is a lot longer. The strengthening is much more gradual. We really take our time to make sure that we don't have regression, because we know that the re-tear rate is so high that we're much more, you'll see the protocols take a lot longer. Now, that being said, the rotator cuff surgeries have gotten a lot better. They used to have larger incisions. There was much more precautions. There was more concerns. With the newer surgeries, the surgeons have gotten a lot better to be much more careful with the surrounding tissue. So I will say that they are generally better on the recovery, not as painful as they used to be, kind of as a group from my experiences. It's still a period where you have to kind of be careful and progress them appropriate and have good communication with the patient as far as the timing and what they can do and what they can't do. But you will find that if you remember from your previous surgery, just consider the rehab component of it, or you're working on it, maybe not. We'll give people sometimes a couple weeks where they do things, and sometimes they'll go independently for a while. There's going to take a greater amount of time compared to the first time. So you've got to have that mental reset that it's probably going to be a longer rehab than you had previously, and you have to be a little bit more patient than you had in the past. That being said, if you had a surgery 20 years ago and now you had a re-tear, the surgery has gotten better. The surgeons are just, better with the tissues. The outcomes, I think, are probably better. And maybe in the next few years, we're going to see surgery is more successful when we look at long-term studies. Right now, we might be comparing some older data, and now as we go forward, maybe we're going to see different things in the next 10 years. We're going to see maybe more success. And also maybe we're picking out the right candidates, or who's more appropriate, for going and having that revision. And we understand which people are better candidates and which people aren't. And we're telling those, and the surgeons are saying, you're not appropriate, let's try and do it for therapy, and they're not taking on those high-risk cases. So hopefully we're going to see over time the surgeries, in a way, we're picking the better candidates for surgery, or the ones that are more committed to the longer haul for our revision surgeries. So we got to consider that. There's also the time. The studies are based on, previous 10 to 20 years. So I hope you have some facts just to kind of make some considerations. My biggest thing is I want you to kind of be armed with more information so you can kind of determine, what's the best, direction for you. And by no means I'm saying not to get a revision, but understand what you're getting into and have these questions ready for a surgeon as far as how it applies to you and the type of rotator cuff tear you have. So you really understand, the odds of success, and kind of make the best choice for your healthcare, because this is a big commitment for your family, time, and all that. It is much easier to try and recover from these things when you don't have the post-surgical restrictions, and it's a little different when you're doing it without having surgery for the second time. So anyway, have a great day. I hope this helped you out. If you enjoyed the information, subscribe to our channel for future videos. Please place a comment and turn on notifications. When you hear about our next video, you'll be notified immediately. Okay? Have a great day.